As India faces a surge in fresh COVID cases, the World Health Organization has classified the JN.1 COVID strain as a variant of interest but said that it did not pose much threat to the public. Based on the available evidence, the additional global public health risk posed by JN.1 is currently evaluated as low. The agency also said that current vaccines continue to protect against severe disease and death from JN.1 and other circulating variants of the COVID-19 virus. The variant has also been detected in Kerala, prompting the centre to issue an advisory to the state government using and urging them to make adequate health arrangements. Variant of COVID is a variant of interest at this point in time. And once again, it's emanated out of China. There's been a strong call across the world once again to ban all flights coming in from China. But the WHO once again playing it down, as they did the first time around when COVID-19 came into play, that this is not to be worried about. And the current vaccine protects against this particular disease. Brian Thomas, my colleague, joins us on the broadcast to talk more about this. Brian, WHO is confident that this is not of much concern. What is India doing in preparation for this menace?
Well, Vineet, definitely the World Health Organization has designated the JN.1 COVID variant as a variant of interest within its parent lineage BA full stop dot 2.86. And despite this classification also, WHO emphasized this global public health risk associated with JN.1 is currently deemed low based on available evidence that they have got. And in response to this evolving nature of the virus also, WHO has urged member states to maintain robust surveillance. And definitely India is doing all the kinds of surveillance that can be done, whereas sharing sequencing data, and even the organization, the WHO, has reassured the public that ongoing assessment and monitoring are also being conducted. Discussion is done at the current surge in respiratory diseases, and even amidst that also the WHO underscored the importance of following public health advice, that to wear masks, especially for senior citizens to wear masks, and even advise for families to stay indoors and to be more cautious of the safety of family and friends during this very holiday season. And even it is the JN.1 variant has been identified in Kerala, prompting the central government also to issue advisories to state governments. There is a they are recognizing the upcoming festive seasons also, that is Christmas and New Year, and advisories of all sorts are being urged to implement necessary public health measures to minimize the risk of increased disease transmission, emphasizing the importance of adhering to respiratory hygiene practices, and especially for elderly, it is being advised so that the elderly should wear masks at all all aspects to maintain the protocol, so that they are not the one who is facing the very, very brunt of disease.
Right. Medical expert and infectious disease expert Dr. Ishwar Gilada also joins us this morning to talk about this. Dr. Gilada, a very good morning to you.
Tell me.
What is the danger, as per you, that this variant poses?
Good morning. Basically, what we have seen in last 4 years is that once it starts spreading, it spreads like a wildfire. If it is silent, it is silent. We have seen last almost 20 months as lull. We didn't have much of any problem. But now this JN.1, which is a subvariant of Pirola, Omicron, that is spreading, and it is not only confined to Kerala. It has been seen in Karnataka, it has been seen in Goa. So it is, and there are deaths also occurring. So I think we should take it seriously. We have to have a kind of multi-pronged approach. Number one, we should do a proper genome sequencing. Number two, wherever there are cases, we should start imposing at least mask mandate. And particularly in those places where there are, or homes where there are senior citizens. Thirdly, we should resume the vaccine production, which is universal vaccine, where all the current and new variant or subvariant can be covered. Current vaccines, they do not cover JN.1 or Pirola or BA.2.86. So in this case, the virus which has a vaccine escape, that means vaccine doesn't work, then this vaccine will be useless. So we need to have a new vaccine. And we need to constitute a new committee, because the previous committee, a lot of people were not even health experts. They were of different specialty. They were, because of kith and kin of some people, they were put on committee. So we need to have a proper national consensus and committee and start working on it. No need to panic for common people, but New Year ahead, Christmas ahead, all the kind of revelries ahead, gatherings ahead, because we have seen that how with a single gathering in Goa, so many cases spread to so many people. Karnataka had only one, but Goa had almost 18 cases. And more number of testings are done, more number of cases will be revealed. So we need to even augment testing.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.